How do you know that you're in good hands with your psychologist? Let's explore what makes for a good therapist. First, why is it so hard to find a good therapist, or why is there such variability in how psychologists practice? Well, unlike going to a physician practicing general medicine, where there's usually going to be a single empirically defined approach to assessment, diagnosis, and treatment, practice within the social sciences is far more varied. The reasons are complex, but we can briefly summarize the problem by contrasting the role of a therapist with that of a general medical practitioner or a family doctor. Note that physical science, like general medicine, is often dealing with observable, measurable, biological objects or events, including physical pathologies like cancers, STDs, and cold viruses that can be objectively verified by a doctor or a lab tech, maybe via CT scan or blood test. In contrast, a clinical psychologist is typically dealing with non-observables, including subjective thoughts, intentions, sensations, and feelings. These psychological issues are primarily defined by what the individual experiences subjectively in the first person. In other words, no objective blood test, even if there were such a thing, would ever convince a person that they were depressed while their subjective mood or state was one of contentment or even happiness. So, unlike physical diseases, psychological problems are not defined by distinguishing physical causes or even a universally accepted explanatory framework. So, some may be surprised to know, for example, that the most popular framework for conceptualizing psychopathology, the DSM, is atheoretical. In other words, it makes no unifying claims about underlying causes and is really only a consensus based descriptive method for categorizing subjectively experienced symptoms, which may have very different underlying causes and require different approaches to treatment. Okay, so what does all this mean? Well, one consequence of not having a unified theoretical framework or model of causation is that therapists must rely more heavily on the theoretical constructs to make sense of the issues that they're trying to understand. And since therapists may not subscribe to the same assumptions, theoretical commitments, or underlying logic, they're more likely to be varied in the kinds of theories that they rely on to guide their therapy work. And this is just one of the reasons why you can go to see different psychologists, describe the same set of symptoms, and get a very different therapeutic approach, because they may be using different conceptual frameworks to make sense of the problems that you want to address in therapy. So if we combine theoretical differences with variations in personalities, clinical intuition, experience, skill, ethical awareness, and so on, we have a lot of factors that could influence the process of therapy. Having a solid theoretical orientation is extremely important. It means that the therapist has a framework that allows them to sensibly conceptualize an individual's problems while suggesting possible paths of intervention and ways of engaging with the client to address their issues. For example, someone working within an attachment framework might conceptualize anxiety as it relates to problems of emotion regulation tied to maybe early family relationships. A cognitive behavioral therapist will typically focus on the cognitive aspect of anxiety, which is believed to arise from dysfunctional negative thought cycles. A psychodynamic therapist might conceptualize anxiety as it relates to emotions and psychological defense mechanisms that might be operating maybe outside of the individual's awareness. So the key here is that a good therapist is guided by just a sensible theoretical framework. So instead of asking the question, what DSM diagnosis does this person have based on their presenting symptoms, they ask, why is this particular person at this particular point in their life struggling with these particular problems? So this focus on a formulation properly contextualizes the person within their relevant history and background, their present circumstances, relationship dynamics, and so on, which allows one to develop a sensible and tailored plan for therapy. So, what is the best theoretical framework? The ideal therapist, in my mind, is a theoretical integrationist. So, someone who is well versed in a number of conceptual frameworks and who has a coherent way of tying it all together. So, this shouldn't be confused with an eclectic therapist who uses a grab bag of approaches or gimmicks that they sequentially try out, hoping that one of them eventually works with their client. So, therapy should not be a place for careless experimentation. An integrationist appreciates that there's overlap with these different theories, but they also recognize that some are going to be more apt to explain a particular client's issues and will point to different kinds of interventions that may better address the core of a client's difficulties, in contrast to just managing surface symptoms. So, if you have a therapist who believes that one framework is going to be sufficient in addressing all kinds of issues or every issue, personally, I'd be very skeptical. And for me, it goes back to the old saying that if all you have in your toolbox is a hammer, everything looks like a nail. So, the integrationist has a large toolbox, but unlike the eclectic therapist, they know how the different tools are complementary and why they might select one over another. I also believe that different contexts will call for varying approaches as well. So, for example, if someone presents with anxiety and they're already prone to intellectualizing, that is, thinking about their emotions without necessarily feeling them very deeply, then a cognitive behavioral approach that focuses primarily on thoughts might only encourage intellectualization and compound, the long-term problems for this individual, even though it might provide mild short-term relief of those symptoms. So in these cases, an emotion-focused, an interpersonal, or a psychodynamic approach might be preferred. So the key here is that a good integrationist will know when to use a given approach and the consequences of each depending on the situation. Another benefit of theoretical integration is that it allows for creative overlap. So I know that in my own training and background in psychodynamic theory and therapy and working with anxiety and defense mechanisms, I know that all of that has actually been very helpful in my approach to doing couples therapy. And so even though couples therapy is an emotion focused approach, sometimes what will happen is that people will become flooded with anxiety or will engage in defense mechanisms, or sometimes a person might even partially dissociate in the appointment. And in these situations, I found that even a 5-minute short-term psychodynamic intervention can actually help to loosen things up and get the process moving again. Although I'm emphasizing theoretical integration as the ideal, I should also say that competence is hard to achieve in one domain, let alone many. So skill and expertise in one modality is still going to be preferable when the alternative is just a minimum to basic understanding of some of these different therapies and the theories that justify them. Still, if you don't know what your presenting problems are about, or if you've been to several therapists without much success, it might be good to work with someone who is versatile and able to conceptualize the issues from some different angles. A final note on the importance of theoretical frameworks is to say that it holds your therapist accountable for what they're doing in therapy. So the therapy should make sense to you, and you should be able to ask at any time, why are we doing what we're doing, or how is this supposed to be helpful? Your therapist's response should be clear enough that you can understand it, and it should be based on sound reasoning and evidence. If your therapist's response is obscure or avoidant, you might want to be cautious. I should also say that most therapists are just very happy to talk about their approach or how they work. So if you don't already have a therapist, you might contact someone who interests you. Just briefly describe your concerns that you want to address. Ask them if they've ever worked with similar issues and about what therapy with them might look like. You should be able to have a good sense of whether that approach would be helpful to you. But you also want to keep in mind that what you think you want might not be what you need. So a common enough example is when a person comes to therapy and they're looking for the therapist to give them advice or suggestions And really, maybe what they need is someone to help them slow the whole process down and help them get in tune with what they're feeling and regulate what it is that they're feeling about the different things that are kind of happening in their lives at that time. Therapist experience is definitely something to consider. So, more years in practice should mean greater exposure to a wide range of individuals with different presenting problems, different ways of just being stuck, and different therapeutic obstacles to overcome. And just learning from experience, what works and what doesn't. So, if the therapist has been around long enough to make mistakes, and if they're, self reflective, they've hopefully learned from them as well. So, an experienced and thoughtful psychologist has reflected critically about their therapy sessions, and through hard work, they developed just like a fine tuned sense of how to best engage with certain personality types, how to time their interventions, how to monitor rapport, when to speak, when to remain silent, when to apply emotional pressure, when to back off and regulate anxiety or emotion, when to offer a cognitive summary or an interpretation, when to address interpersonal issues that could come up in therapy, and so on. So they develop a honed and implicit intuition that becomes instinctive and reflexive, almost like muscle memory. So watching a master therapist at work is pretty amazing because they're able to track some very complex things in the therapy room while also remaining completely present and engaged with their client. But experience doesn't necessarily translate into a better therapist. It means that they had more opportunities to hone that ability. Whether they capitalized on those opportunities is another question. So, as with any profession, experience is beneficial for the capable practitioner, but longevity can't substitute for competency. So, a psychologist may have been working in the field for so long that they're just tired, and at this point, they're just kind of going through the motions. Failed therapies are blamed on their clients, and they miss out on opportunities for growth and learning. We can also imagine a young therapist with less experience who's able to really make up for it in terms of their eagerness to learn, their natural capacity for empathy, interpersonal intuition, intelligence, and other valuable qualities and skill sets. Expertise is a kind of specialized knowledge or skill in a given area. So we can think about expertise in terms of diagnostic populations, issues involving anxiety, depression, trauma, relationship problems, or expert skill in working with various demographics, including client age, culture, gender identification, sexual orientation, and so on. So let's start with specialization according to the problem focus, presenting symptoms, or the DSM diagnosis. So to me, this is a matter of extremes. So obviously, a therapist can't be expected to treat every kind of psychological issue or problem. And I'm sure everyone's heard the quaint phrase, jack of all trades, the master of none. So someone who claims that they can treat every kind of psychological issue is probably spreading themselves too thin. We can't be all things to all people, and the kind of knowledge or training or skill that it requires is way too much. So be wary of anyone who's claiming to be an expert in every kind of psychological problem. But I also believe that it's possible to become just over specialized in a given area where someone focuses a little bit too much on one kind of issue, such as anxiety and depression, to the exclusion of others, maybe obsessive compulsiveness, relationship issues, or even existential issues. So it's a well-known fact that presenting symptoms or the DSM diagnoses have considerable overlap. So if the issues that we claim to resolve are too narrowly defined, I think we risk treating our clients almost in a cookie cutter like fashion that's going to be decontextualized from the real world environments and the lived experiences of our clients, which are going to be very complex. A good psychologist should also know the limits of their knowledge and their competence, And if they feel like the client's issues might be bordering outside of that area of competence, they should probably talk openly with their client about this issue and the possible options, including a possible referral if necessary. So, for example, if a therapist is treating someone for depression or anxiety, they might need to refer if additional issues come up that might involve like an eating disorder or even addictions. Okay, what about expertise based on working with certain client populations or demographics? Well, I think some of the same ideas apply here. So it does take some expert knowledge and skill to work with different populations. So, for example, working with an individual adult is going to be very different from working with a teen or an adolescent. There are obvious developmental differences and sensitivities that may require additional knowledge or a variation in style or approach. So, for example, an adult almost always wants to be in therapy or can at least self identify a problem that they want to work on, unless maybe it's court mandated. And this isn't always the case for adolescents, and it's often the parent who identifies that there's a problem, and the teen's will to be in therapy is questionable at best. So, a therapist, of course, needs to realize that these situations call for different approaches, different skill sets, which may take some time to develop and preserve. In addition, if the therapist is working in multiple areas, they have to maintain a larger knowledge base and skill set. They have to be capable of moving fluidly between these different skill sets as they're called upon. So, personally, I prefer to keep my practice a bit diversified. So, I work with older children, teens, adults, and this allows me to sort of stay in tune with these different kinds of issues and how they're experienced at different developmental stages, which I find helps develop this kind of fuller conceptual understanding of the problems I'm trying to help people with. Most of the theories that I draw upon are also have more of a developmental kind of bent to them, and this also makes it feel a little bit more natural or fluid in how I move around in that stuff. I also enjoy working with diverse therapeutic contexts as well. So working with individuals, couples, and families, and this will call for different skill sets as well. So as long as the therapist is working within their level of competence, this kind of diversification can often keep the therapist energized, sufficiently challenged, and ultimately connected to the people that they're trying to help. We can also talk about competence in working with different cultural contexts or gender orientations. And, there are different schools of thought on this, but I think there's going to be a healthy balance between having the knowledge or awareness of the kinds of issues that may present for these particular people, given their context. But being open enough that one doesn't just overgeneralize or make assumptions about this individual and how they're experiencing their problems. Trust means that you have good reason and a gut feeling that you're in good hands. So your therapist presents themselves as professional and yet human. They seem to be aware of appropriate boundaries. They start and end the appointments on time. They ensure that the therapy work stays inside the therapy office, and they don't lapse into informal chatter that could blur the lines between professional and friend. They're focused on you, and they won't use your time in therapy to talk excessively about themselves or to go on irrelevant diatribes. Trusting your therapist, though, is not the same as always feeling comfortable in the therapy room. So, good therapy often involves facing uncomfortable thoughts and feelings that might be habitually avoided. So, a good therapist is going to, push you in that direction, to face and tolerate uncomfortable feelings as long as that's in alignment with your overall stated goal and, of course, in your best interest. So in this case, trusting your therapist means having a good sense that their interventions are ultimately well-intentioned and that they're meant to be helpful, and hopefully that they are helpful. A related theme involves therapeutic rapport. So in this case, you feel connected to the person that you're working with, and you feel like you're working toward the same goal. You feel like your therapist understands. And sometimes what happens is almost like an unspoken chemistry that you have with another person. And so you just kind of click with this individual in a way that's very reassuring. Another important piece, and one that's hard to articulate, is the therapist's capacity to assist in regulating distressing or overwhelming emotional states. So this means that the therapist is comfortable exploring heavy feelings, that they can actually track how you're doing in the session and assist if necessary in helping ground you to your experience in the room. Some good signs of this are if your therapist is calm and yet you feel a sense of their attuned and assuring presence, often through nonverbal communication, such as tone, facial expression, physical gestures, and so on. And so it feels easier to regulate these distressing thoughts and feelings in this person's presence, and that's obviously a good thing. If the therapist seems misattuned or non-expressive or detached from what's happening in the therapy room, then something is probably not right. So in doing a little bit of research for this video, I came across a comment by someone who said something to the effect of, "My problem with therapists is that they just don't care. And you're paying them to listen to you. So I don't blame them for not caring, because after a while of listening to other people's problems on a daily basis, you eventually become numb to it." Now, for me, this is, unfortunate that people have these kinds of experiences. Just because you're paying someone to do a job doesn't mean that it's okay for them not to care. But first, you might want to check this out with your therapist. You might want to say, I had this feeling like you don't care to listen to me today, and just see what they say, see how they respond. If they get defensive, that would be a bad sign. But if they seem genuinely concerned and work with you to figure out what's going on or why there's a misattunement, that would obviously be good. Part of what will allow for a therapist to be present and have that capacity to regulate emotional states is their own capacity for self-regulation and ensuring that they've done their own therapy work to resolve issues that could get in the way of offering a quality therapy experience. Personally, I think that every therapist should have done their own therapy, just to ensure that they aren't carrying any excessive baggage that could get in the way, or to know what their own blind spots are to make sure that they're not neglected in the therapy work with their clients. I would even ask a therapist if they've ever been in therapy before, and you should be able to get a yes or no response in a matter-of-fact way, maybe with a follow-up question asking, why this is an issue or why you're concerned about it. Just don't expect them to tell you exactly what it was that they were addressing in their own individual therapy. So if a therapist is poorly regulated, they'll seem stiff and they will lack this spontaneous and attuned facial expression. They may become reactive to your own emotional material, or they may become uncomfortable so that they prefer to just intellectualize about your problems. So if this is the case, you'll probably notice that there's a lot of talking happening in the appointments, but not much else, and no discernible shift in how you're feeling emotionally. While the therapy relationship is a professional one with boundaries, there should also be a high degree of honesty there as well. So good therapists will be careful about disclosing personal information about themselves, but that doesn't mean that they won't share their thoughts or feelings about the therapy relationship, especially if you ask. So it's almost always in your best interest for your therapist to be honest with you about how you're being perceived by them. So if a person comes into therapy to resolve, some kind of relationship issue, and I'm noticing that I'm feeling attacked by this person or criticized by them, I'll first maybe, check in with myself to see if it involves maybe some of my own stuff or something I'm reacting to. But if not, I'll share with my client how I'm feeling. And I might ask them if other people in their lives maybe feel the same way. So this kind of interpersonal sharing is often, very helpful in therapy. But, it also cuts both ways. So again, if you find yourself reacting a certain way, maybe feeling criticized by your therapist or sensing that they might be, bored or frustrated with you, or even if they did something and it irritated you or made you angry, then you should try to tell them. So a good therapist shouldn't get defensive and should, care about what you have to say and care about how you're experiencing them. Another way in which a therapist can be honest is just demonstrating some humility. So, humility when they don't know the answer to something or when they make a mistake in therapy. So, a good therapist will apologize if necessary and repair a relationship after a misstep. So, good therapists are also, of course, quick to consult with colleagues if they're feeling stuck in the therapy process, and get suggestions from other professionals. So in the end, it is important to just trust your gut, so whether it be checking someone out over the phone or online or taking a chance and engaging in some sessions. And I usually tell people that, by the third or fourth appointment, you should get a feeling that we're onto something and moving in the right direction. And if you still don't have that feeling by then, you might just bring it up with your therapist and just see what they have to say. And again, if you're presented with defensiveness, then it's just probably not a good fit. If you have additional thoughts on what makes for a good therapist, add your comments below. And of course, if you enjoyed the video, subscribe to our channel for future mental health related topics.